Dear Pilgrim, the Ministry of Hajj and Umrah in the Kingdom of Saudi Arabia seeks to serve the pilgrims to the sacred house of Allah by educating them. For this purpose, we present to you a set of educational guides which review the most important procedures and recommendations of interest to the pilgrim performing Hajj and Umrah, and introduce you to the most important services which will facilitate your Hajj journey. Health Manual Guide. The commandments and directives of Islam are based on preserving the body and health, and prevention before falling ill through cleanliness, food and drink safety, and even the prohibition of staying up late for no reason, which makes us live a healthy and sound life. The Hajj pilgrim should take care of his prescribed medications and be sure to take enough with him to the different sacred sites of Hajj. It is necessary to store medicines at an appropriate temperature. Dear Pilgrim, pharmacies can be located around the sacred mosque and throughout Mecca, but there are no pharmacies in Mina, Muzdalifah or Arafah. Rest assured, health and emergency centers can be located throughout the sacred pilgrimage sites. Steps to prevent food poisoning. Avoid storing or eating cooked food a long time after it has been distributed. Make sure to wash fruits and vegetables before eating them, and avoid buying food from street vendors. Face masks are to be used. It is advised to wear a face mask if you have symptoms of a cold in order to prevent the spread of infectious viruses. It is encouraged to wear face masks in spaces and sites of gatherings and crowds, inside the sacred mosque, the Prophet's mosque, while performing the tawaf, the sa'i between Safa and Marwa, and stoning the Jamarat. To prevent yourself from coronavirus, make sure to wash hands frequently with soap and water, use a face mask, and avoid touching the eyes, mouth, or nose in crowded places. Pay attention to personal hygiene, keep a safe distance from others in crowded places, and use hand sanitizer. Health advice for shaving. Choose an authorized barber and avoid barbers offering services on the roads and sidewalks. Ask the barber to wash his hands with soap and water and make sure he is using disposable razors. Warning: used razors exposes the pilgrim to the risk of contracting infectious diseases, the most dangerous of which is hepatitis. Health tips for pregnant women during Hajj and Umrah. Wear loose-fitting cotton clothing and appropriate footwear. Drink enough fluids. Avoid big crowds, extreme heat, and any excessive physical exertion. Use concessions which you are allowed to make within Islamic law, and send a representative to stone the Jamarat in your place. When traveling with children, make sure of the following. Put a bracelet around the child's wrist containing name details and your phone number. Complete the child's basic vaccinations and do not take them to overcrowded places. Ways to prevent respiratory diseases. Maintain distance from infected people and avoid drinking very cold water and direct exposure to air conditioners. To prevent gastroenteritis and diarrhea, be sure to follow the rules of food safety and hygiene. Make sure that any meat is cooked well and avoid buying food from street vendors. For the prevention of sunburn on the skin, make sure to always use a parasol. Avoid exposing the body to the sun except as required by the rituals, and use sunscreen. Dear Pilgrim, to prevent heat stroke, do not go out during the day, except for a need or for performing a ritual. Avoid revealing anything from your body except what the rituals command, which is the head during the period of Ihram. Carry a parasol with you during the day and drink more fluids. Dear diabetic patient, Put a bracelet around your wrist or carry a card with you, clearly stating that you have diabetes and indicating the type of treatment you are using. Take a glucometer with you and measure your blood sugar daily. Be sure to take an adequate set of diabetes medications with you and make sure the insulin is cool during your tawaf, circumambulation, and sa'i between Safa and Marwa. Medical advice for heart patients. Take an adequate amount of medication. Be sure not to subject yourself to excessive physical or nervous exertion, and take a break when you feel chest pain or shortness of breath. Tips for hypertensive patients. Consult a doctor and ask for medicines before traveling. Be sure to move and walk around on the plane. Monitor your blood pressure before traveling and during Hajj, and plan your medication timetable well. Finally, when you feel the symptoms of an asthma attack, you should do the following. Use an asthma inhaler immediately and visit the nearest health center or hospital. Wishing you a disease-free Hajj and Umrah and a cure from every disease. Thank you for listening to the Health Manual Guide. With greetings, Ministry of Hajj and Umrah, may Allah accept your Hajj and your good deeds.